Hi, I'm Nikki. I am a senior surgical nurse and I have worked here since 2017 in the surgical department full-time. I did GP nursing for 4 years before I moved here, and I always just had an interest in surgery. So I used to work with Dr. Chris Franklin in general practice, and then as I worked for the company, he came on to ERH. Then I was really lucky and I applied for the position and I got it. I guess because I'd had that interest in surgery and I knew what it would be, I just got really excited to come on board. Coming into a specialty department, it can be quite daunting. I never really thought that I was ready, but it was something that when I did apply, they were very welcoming, and having not quite the skill set yet, they had the tools there to help me develop that. And so I guess I always wanted to be able to offer gold standard nursing, and that is what specialist is. So it wasn't an enrolled course or anything like that. All of our further learning we sort of do on the job. So we work really closely with specialist anaesthetists, and they work with us 4 days a week, and they help us out with difficult anaesthetics, any questions that we have, pain management, all that sort of thing, post-operative care. And so we learn on the job, and it's, for me, that's better than a course because I learn better with hands-on sort of approach. So when I came on board, the surgery team was much smaller than it was. I was a surgery nurse, and now I've progressed into a senior surgical nurse. As the team has expanded, we've got more need for a leadership role. Part of my job is basically to sort of run the day, the surgery schedule, as it is quite busy, so we are in need of that. So I've been able to step up into more of a leadership position. We've got a really good structured management team, so I have people that I can go to, like the surgical team leader, to discuss any questions or concerns that I have. So we could have sit-downs once a week, discuss any issues we have or any support that I might need, and we can sort of brainstorm through any issues or look at doing any sort of further development for me to train me up to where I need to be. At the moment, I just want to work on my skill set. So I just want to progress in my anaesthesia skills. Short-term plan, that's probably where I'm at. Long-term, I do like the leadership pathway. So I guess that's something that I'll hopefully go down at some point further than senior nursing. We work with a really good team of people. Even though it is quite a serious sort of workplace with the work that we do, we all like to have a bit of fun. So I think that's what makes coming to work every day better, when you're working with people that, are enjoyable to be around. It's a really supportive culture in that, I know it can be daunting coming from a general practice or anything like that, where you can doubt your own skill set coming into specialty. But I think the biggest thing here is that everyone is really patient and everyone is aware that everyone is still learning. I'm still learning things, and that is definitely a benefit. Being where we are as well, we're really close to the beach. So sometimes if you just need a bit, it's only 15 minutes drive down to the beach, you can sort of take a breath. I think having that ability to have that work-life balance, we're in a good headspace when we come to work. We've had a good break, we've had the weekend, we don't have to work those compulsory weekends like general practice does. So we do the on-call where we come in for a few hours on the Saturday, discharge our patients, and then we're available if the surgeons need us during the days. But apart from that, we get 6 weekends where we don't have to work the weekends. So I think the work-life balance is definitely a big key factor in working in such a busy department. What ERH offer is such a wide range of services, and we have access to, some of the coolest equipment, training as well, so there's never a boring day. And because we have so many departments, there's so much to offer, and it's exciting. So I think coming from, another clinic or something like that, you just learn so much coming here because there's just so much available to us, which gives us the ability to have that gold standard nursing care, which I think is really important.